Welcome, everyone. We just give a minute for people to join. Good morning, good afternoon, good evening. Welcome to everyone, especially those who are joining from far away or from somewhere it's early in the morning or late at night. Welcome to today's EPIWIN webinar on the new WHO MERS-CoV dashboard, enhancing transparency and timely access to information for public health decisions. It's the first time that WHO has developed such a dashboard, so it's a huge milestone. And today we have with us Dr. Maria van Kerkhoff, Director for the opening remarks. Then we have Dr. Sophie von Dobschutz, who will introduce you to the dashboard and how you can use it. Then Dr. Abdullah Sayafi, Abdullah, will speak on exploring more resources, what you have for MERS. We have Philippe Jean-Pierre Boucher, who will talk about the data and how you can be leveraging shared infrastructure services, expertise for efficient data dissemination, and Apuv Pal also from Data Exchange, who will talk about user feedback and future enhancements. We then will hear from you, and this expert team will answer your questions, and that will be moderated by Dr. Abdullah. Thank you very much. But before I hand over to Maria, some housekeeping as usual. This webinar is being recorded, and the recording and the presentations will be shared with you and will be uploaded to our website. We love to hear from you. As you know, if you're a regular EPIWIN audience, please tell us about yourself and where you come from and what you do in the chat. But we would like to hear about your questions and answers in the Q&A box, not in the chat. That's so that we can keep track of your questions clearly. And finally, this is for learning, for sharing information, learning from each other. So please, please be respectful and positive and constructive in your comments. And let's, have a nice, healthy, positive atmosphere here. Thank you so much. And with that, I'd like to invite Dr. Maria van Kerkhoff to provide the opening remarks.
Thanks very much, Supriya. Good morning, good afternoon, good evening, everyone. Thank you so much for joining us. Today is a really special day for us at WHO to launch this MERS-CoV dashboard. And it's especially special for me because I've been imagining this dashboard for quite some time, being involved in MERS since 2012. And actually, some of my earliest start with WHO. I think everybody who has been involved in making this a reality, from countries and their surveillance for MERS-CoV, through the reporting of the international health regulations, for all of the enhanced surveillance work and outbreak investigations to learn more about the extent of infection, the reasons for the spread of this pathogen, which was important for maintaining this database, as well as how to stop outbreaks, to all the staff in the ministries of health, the ministries in the different animal sectors, environmental sectors, and to our country colleagues, our regional colleagues, to my MERS-CoV team, who you will hear from in a little bit, here in my department and headquarters, and the Datadot team who helped turn this into a reality. As we all know, and as you've heard us say many, many times, timely and transparent data sharing is absolutely vital for early warning, for responding effectively, and for preventing epidemic threats. It allows us to act quickly, to communicate clearly, and to coordinate globally. If I may use this opportunity to urge countries to continue with strong surveillance for coronaviruses, including MERS-CoV, and of course, let's not forget about SARS-CoV-2, the virus that causes COVID-19, and a special plea to countries to continue to sequence MERS coronavirus and share these sequences with publicly available databases so further molecular analyses can be conducted. MERS continues to be a serious public health concern, a public health threat, especially in regions where zoonotic transmission from dromedary camels to humans is happening. Though current case reporting is sporadic, the potential for outbreaks, the potential for public health impact of outbreaks and epidemics is significant. That's why today's launch is so important and such a milestone for us. This dashboard is the first time we are able to display key data, trends, summary statistics, and relevant additional resources in one space since MERS was first reported in 2012. Here at WHO, what we're attempting to do is to visualize the data that's been provided by our member states who share this information on MERS patients through their commitment under the international health regulations. By bringing this data together and analyzing it at a global level, you'll also be able to see what you could do at regional levels. The dashboard supports our collective ability to monitor, prepare for, and respond to MERS-CoV as part of the broader epidemic intelligence and One Health efforts. It also reflects WHO's commitment to innovation and public health using digital tools to make this information easily accessible, to make it clear, and to make sure that it's actionable for decision makers, responders, and researchers. I encourage you all to play around with the dashboard, use it in your work, share your feedback, let us know what you think and how you think we could make it even better. Today, we present the first prototype of the tool, and your insights and your feedback will help us shape this into the future. Thank you so much for being a part of this milestone today. Thanks again to all of the people who have made this possible, especially to our member states. And the teams who are working on the ground who are actually conducting the surveillance and reporting it to WHO. Back to you, Supriya.
Thank you very much, Maria, for that comprehensive overview of why the dashboard is so important. I now invite Sophie to talk about the dashboard itself and what you can do with it. Over to you, Sophie.
Thank you so much, Supriya and Maria. Indeed, this is a very exciting day for all of us because it's the first time that WHO makes the MERS case data publicly available in this format, in this accessible format. And before we dive right into, I would like to thank a few people who contributed to making this happen today. So first of all, you, Maria. It was your dream for a long time, and you infused us with your enthusiasm to make this dream a reality. And here we are today. We have Abdullah Al-Sayafi from my team who will speak later, also Apov Pal and Craig Schultz, who worked tirelessly, especially in the past weeks, on designing and building and populating the dashboard. Then we have our colleagues in EMRO, Hala Naja and Amar Barakat and Amir Aman, who also contributed to the design, as well as did our dear collaborator Ruth McCabe from the Imperial College and Anna Funk from the University of Calgary. And a special thanks, of course, going to the Public Health Authority and the Ministry of Health in the Kingdom of Saudi Arabia, who provided input on key variables that you will see on this dashboard in a minute, and reviewed all the data with us. So we made sure actually in advance to this launch today that all our data that we keep at the HQ database is aligned with the data that the Ministry of Health and the Public Health Authority are keeping in Saudi Arabia. So we're very proud to have achieved this ahead of the launch. Let's take a closer look at the dashboard. I will share my screen. And just a second. Here we go. So here we are. I would like to ask Abdullah, if he hasn't done so already, to share the link with you in the chat, because it's live. The dashboard is live. Actually, while I take you through it, you can already start exploring it and playing with it. And on the top, you first of all find the key facts about MERS. It's a zoonotic disease with its animal reservoir in camels. And it has quite a high case fatality rate in humans. And with its epidemic and pandemic potential, it's indeed one of the key public health threats that WHO is monitoring and is preparing for. And just to say that the data presented in this dashboard are from confirmed human cases globally that were reported to WHO through the International Health Regulations reporting mechanism by our member states. And so this is a global dashboard, and you will on top find a map with all the cases that have been reported since the emergence of MERS coronavirus in 2012. You can look at the global distribution of these cases, and you find on the right-hand side, you find the cumulative numbers also displayed. And then, sorry, I hope you can't see these popping up. I didn't know how to inactivate them, my messages. So here you can see on the right-hand side the cumulative numbers, and also the breakdown by countries as well. And as the name Middle East Respiratory Syndrome Coronavirus says, so the current epicenter is actually in the Arabian Peninsula, in countries of the Eastern Mediterranean region of WHO. So you can also switch to this view that shows you, provides you more insight on this region and the countries affected there. I'm switching back to the world view. And now moving down, and here you will be provided with a breakdown of the MERS cases and the global trends. So first of all, we have the epidemiological curve since the emergence in 2012. You will notice we had in the early years these very huge peaks. These are hospital-related outbreaks that occurred mostly in Saudi Arabia and other countries in the Arabian Peninsula, but also through an exported case in the Republic of Korea. And thank God, over time, IPC measures and follow-up of contact tracing were significantly improved. And you can see these peaks becoming smaller and smaller and smaller. And actually, since 2020, when the world was dealing with the global pandemic of COVID-19, thank God we got a little breather on MERS, and you can see these cases going down even more. And because the scale is now very different to these previous huge outbreaks, we actually provide you a second graph here that just focuses on this period since January 2020 and the case numbers since then. And so on the right-hand side here, you can see that the cumulative number of cases reported just in the last 90 days, and it was 8 cases. And for your information, all these 8 cases were actually reported by the Kingdom of Saudi Arabia. I want to draw your attention on this little tab here to download the data. If you click on that, and let me just stop here and share again, and I'll show you what this download looks like. Here we go. So this is also a first. For the first time, you're actually able to download key data from these confirmed MERS cases reported globally. So you will have the date of download and which country, then to which region the country belongs, the cumulative number of cases reported by this country, and also, quite importantly, the date the last case was reported by this country. And I think this is important information that many users of our data have asked us to include in the past, because if you need to understand current outbreak situation or current epidemiological situation in countries, and if it's safe to travel there, or what precautions have to be taken if you want to travel there, or if you're a clinician and you're dealing with a suspect case which was traveling in the past, you can actually check if the country this person was traveling to had reported MERS cases quite recently. Okay, going back to the dashboard. Sorry for this back and forth, but I thought you will appreciate seeing this as well. Okay, here we're back. I'm moving down again. Now we're coming to some key variables that we are analyzing on the data. So first of all, it's the cumulative number of MERS cases reported, and you can see that by WHO region or by World Bank income groupings. And then we have the age and sex pyramid, where you can actually see the trends. We have much more males affected, actually, and also older males from 30 years onwards. So that's very easy to see. And of course, we encourage you to use these data for your work, and you can take these graphs from the dashboard, of course, and use them in your presentations, or if you have to report on the latest situation. You also have some breakdowns just on the age and the sex variable. And then we look at occupations that these cases have reported. Importantly, also to look at those occupations that are more at risk of infection, for example, the healthcare workers or those working with camels. Then we have grouped all other occupations together. And I also want to point out that we are featuring the not reported data as well. So of course, we're trying to have a data set that is as complete and as comprehensive as possible. But the dashboard is only as good as the data that are being fed into. And so for quite a number of these variables, we actually have a number of not reported instances. And this is maybe also a shout out to all the member countries who are reporting cases, not only for MERS, but also for other reportable diseases. First of all, thank you very much for doing that and doing that comprehensively. And here, maybe this is a good example why it is so important to have all these details reported, because then we can display them accordingly. We have also looked at likely places of exposure as determined by epidemiological investigations in the countries reporting cases. So you can see here healthcare it is ranking quite high, but we also had cases likely exposed in the community or in the household. Very few at the workplace. And then again, we have this number where it's just not reported. As MERS is a zoonotic disease, we're also looking at what cases report on exposure to camels or their products. So in this case, we had 223 cases who reported such exposure. And I want to point you to these links that go to the World Organization for Animal Health database and the Food and Agriculture Organization of the United Nations database, which actually keep track of information on reported MERS-CoV infections in camels, if you're interested. So you have that also on the top of your fingertip. You can move between these different dashboards and databases to get your information. We have looked at symptomatic versus asymptomatic cases, and also at those cases that were admitted to the hospital or even in intensive care units. So you can see on the right-hand side, this graph has a slightly different denominator, because obviously people who ended up in ICU were hospitalized in the first place. So all these ICUs are included in the hospitalization number as well. And then again, we have, for quite some of the cases, we don't have this information reported. We are also interested in looking at the confirmed cases by category. And what do we mean? So we mean, was this case a primary case, either because it was likely exposed from camels, from the zoonotic source, or because simply we couldn't identify any primary source, other human case from which this case could have contracted the disease. So these are categorized as primary. Then all the secondary cases, for them, it is confirmed that they got infected from a primary case, the tertiaries from the secondary, and so on. So this is important, especially when you keep track of outbreak development and analyze the data that you have related to outbreaks. Unfortunately, one of the high-risk groups are those people who already have underlying diseases. So again, we provide this data for you, and you can see quite a high number has an underlying disease of these cases, but also for quite some of it, it's not reported. And then we also break the data down by the most commonly reported comorbidities listed here, also to give you an idea on the kind of risk factors that for these high risk groups that have shown to develop MERS-CoV, and especially a more serious development of the disease as well, based on the underlying conditions that they already have to deal with. We're already at the end of this page, so just quickly to point you to the glossary. And for any doubt on the terminology, the terms we use, you can find them explained here, as well as the copyright and licensing. There's a citation that you can use here, highlighted here. If you want to use the data, please also include a citation or refer to our dashboard. Yeah, here are the full disclaimers for terms of use and indemnification of WHO in case you're interested. And with that, I stop here. I will continue sharing, but I'll mute myself because next speaker is Abdullah, and he will take you through the more resources section.
Thank you, Sophie, so much, and thank you, Maria and Supriya. I will just speak about regarding the more resources. So good morning and good afternoon and good evening, everybody. Wherever you are in the world, I want to take just 5 minutes from your times, not more than this, not to go over a list of documents or links, but to tell you the story behind them and how to get benefit from them as well. So the story of how we across WHO and in collaboration with our partners at FAO and WOHA and member states as well have worked as a one team to build a strong and coordinated response to MERS-CoV. So let's begin with the first one, which is the MERS-CoV trackers. So if you have already explored it, that's great. Then you can help me get benefit from that, and you can share your feedback as well. But in case you haven't, so the MERS-CoV tracker is not just a map. It's a living interface that brings research to life, whether you are tracking a seroprevalence in camels handlers or following exposure studies in workers. That's really helpful. And this platform is powered by WHO, FAO, and Zero Trackers through Calgary University, compiles peer-reviewed field research across human and animal populations. It helps us see not only where we have been, but also where we should focus next. And closely linked to this are the disease outbreak news, or DAWNs, as we call it here in WHO. So each time an outbreak occurs regarding MERS, whether it is a clusters or nosocomial event, these reports provide timely structures, updates, and answers who, where, and how many, and what's being done in the place that the outbreak happens. So the DAWNs are powerful snapshots combining field investigation and transparent reporting. And to understand the basics, we turn to the MERS-CoV fact sheets. So it is very simple, yes, but it's comprehensive. It tackles the key questions. What is MERS-CoV? How is it transmitted? And what are the symptoms? How can we prevent it? Whether you are a frontline healthcare workers or curious members of the public health, this fact sheet offers a science-based starting points. And from there, we move into a broader analysis with the global summary and risk assessment, as all of you I bet aware of it. So this is not just a raw data. It's a refined interpretation of MERS-CoV, threat, its weight, zoonotic transmission, ongoing human case, and healthcare-associated risk, and more. So, and I really encourage you, if you're really interested about MERS-CoV, to read this risk assessments. And if you see more, one of the documents and links we have it, WHO Emerald monthly situation updates, the bulletin. So this update dive deep into recent trends, country level reporting within Emerald regions, and seasonal patterns, especially from the countries where MERS-CoV is most inactive. And now let me share one of the most practical tools we have. And to be honest, I do believe it's a piece of art, and this is what we call it, the Unity Study Investigation Protocol for MERS-CoV. So these protocols are like a field manuals for the teams and on the ground. Imagine a country confirms its first case. So what's the next step, right? So one of the protocols guides you on how to investigate the first few X cases and their contacts. And if you need to understand how the virus is spreading from within the hospitals, there is a cohort study protocol for healthcare workers, right? Or if you're curious about what surface in the hospital might harbor the virus, yes, we have that as well, a surface sampling protocols. Then there is a case control study of protocols, which helps uncover risk factors for the infection, and for countries with the camel exposed workers, the cross-section studies and the protocols. So this is really, really helpful tools, and I would believe it's one of the best tools. We have worked really hard and to update it and to make it very friendly wise. All together, these protocols form a practical, flexible toolkit, whether during an active outbreaks or for preparedness. They are ready to use, baked by WHO technical expertise, and soon it will be available in both Arabic and the French language. All of this is connected through the WHO MERS-CoV health topics. So this is what we call it, the central hub, pulls everything together: guidance, update, protocols, communications, the main portal where the experts, responders, and policymakers alike can find the latest tools and informations. And one of the most important things, if there is an outbreak, what you're going to do. So we have dedicated link, and the documents directly help you in this one. So this link and this document, every second, so whenever there's an outbreak, every second counts, right? That's where the WHO MERS-CoV outbreak tool box comes in, like a grab and go kit for responder. It's filled with ready-to-use template, checklist, and etc. It's really helpful because we know that every second matters whenever there is an outbreak. And of course, no MERS strategy would be completed without addressing the animals-human interface, right? And this section on MERS-CoV infections in animals maintained with our partners at WHO, at WUHA and FAO, and they really encourage you to explore these links. So as I come at the end, so as you explore the more resources sections on the MERS dashboards, you're going to notice and remember that this is not just a link, like a list of tools or like a bunch of links. It's a living framework, right? Rooted in science, refined by experiences, and shaped by global collaboration. Every resource tell you the same story, but from different angles. And I'm really encourage you again and again to have a look to the various documents and tools we have prepared for you. And our goal at the end is the same, right? To protect and to help, to protect and contains if there's any outbreaks. And this is like from my side, and I'm very happy. If you have any question, please do not hesitate to write it down in the Q&A. And over to you, Supriya. That's it.
Thank you very much, Sophie and Abdullah, for that comprehensive overview of the new dashboard. And I hope amongst the audience, you're also checking it out with the link and seeing how it can be useful for you. But now, for more information on what you can do with that data, I would like to invite Philippe Jean-Pierre Boucher. Over to you, Philippe.
Hi, everyone. I'm Philippe Boucher. I'm the unit head for the data exchange team here in Geneva in the Department of Data and Analytics. So wait, I'll just let this slide maximize. There we go. So thank you. So what I'll talk to you briefly about is a little bit of background about the World Health Data Hub, which is the infrastructure that's used to implement the MERS dashboard and other dashboards like it. So first, a little bit of history. Where did this all come from in the first place? Well, if you go back about 5 or 6 years ago and we're looking for WHO data, what you'd find would be described here in a tiny, tiny little sampling of portals, websites, electronic applications running on the web, sometimes not on the web, on PDAs, on phones, like really a colossal collection of disjoint data. So the thing that was interesting with this is none of it was really discoverable or findable particularly easily. And when you looked at it, in fact, they were all the same. So they were all data through some sort of process with some visualizations, some reports, and some level of metadata. And yet all of these things were completely different. So we're talking about order of magnitude over 100 different types of technology used to disseminate these, no standards followed across all of the data sites, a different approach for managing metadata and process. So they're all quite different, yet trying to accomplish the same thing. So next slide, please. So as part of Dr. Tedros's transformation agenda back in 2018, 2019, we commissioned some work with Deloitte so that they could start to analyze sort of really the minutia of what was going on here. What were all of these sites? Where were the things that were broken? What worked? And trying to understand exactly what the situation was in terms of what we would need to do to bring it under control. And we whittled it down to 4 broad categories. Process, and namely identifying both what are the inconsistencies in all of our processes, but also what is the actual process that WHO mostly uses for managing an end-to-end data process. So it turns out that it was actually quite similar across the units, but again, individual little steps were all different. In terms of technology, literally hundreds of different approaches to technology, everything from like a collection of about 50 different content management systems to, at last count, about 80 different types of technology used for data acquisition, a number of different visualization tools. So really quite varied. In terms of data, the modeling and representation of data was inconsistent and different across all of the technical units. And this is not to say that anyone was doing anything incorrect. They weren't. Everything that people were doing was correct, but it was different from what everyone else was doing. And then in terms of the people involved, a highly variable set of skills and experience. In some cases, people were just dropped into a position of being a data manager without prior experience and had to work their way up. And in other cases, a team would be able to actually go off and actually hire like a short-term or a fixed-term staff with a degree in statistics and mathematics to be able to deal with the data management issues. So again, highly inconsistent. So the result of this study was to define what do we need to do to corral all this together into an approach that can be used by everyone. Next slide, please. So I'll just ask you to keep clicking so it all pops up at the same time, please. Just, yeah, keep going, keep going. One more. One more click. Thank you. Oh, one less click. Perfect. So this analysis defined what would become the World Health Data Hub. So the World Health Data Hub is a combination of infrastructure, tools, services, and standards that we've implemented to support WHO programs in the full end-to-end work of their data management processes. So this is everything from the initial conceptualization of acquisition of data all the way to the final dissemination of the data to the public. So we have 6 base components that are interlinked together to make this happen. So in no particular order, because actually the cycle can begin at any point when we engage with a technical program. So first we have the member state engagement portal. So that's the service that we use to handle consultations for estimates and other contacts around statistics with our member states and other stakeholders. But we've also started using it for managed data collection exercises on a large scale. So this is when we're trying to run a survey across like 150 countries or all 194 member states. We use the country portal to support that activity. Then we've got the dissemination platform, which is in 2 parts. It's the data.who.in website, and then there's a visualization library that allows us to do responsive, accessible, multilingual, and lightweight visualizations so that they're really easy to absorb by our different users and are implemented in such a way as to be consistent with WHO's publication policies and accessibility policies. Then we've got underneath, we've got our data hosting capabilities. So that's a combination of different things, which is an Azure data lake for basic storage of unstructured data, and XMart, which is an internal product to serve as our data warehouse. Then we have data acquisition and modeling. So this is a combination of using, again, Azure machine learning and virtual machines with a whole bunch of statistical analysis tools loaded into them to assist technical programs in not only doing their work, but collaborating on their work across multiple people. And these people, of course, can be anywhere. You can be inside HQ, they can be working HQ, region, university, and so on. And the last piece of the puzzle, so it's actually in two pieces here, and this is in progress. That is the construction of a complete data catalog and a data activity calendar. So this helps you figure out what is going on, when are things happening. It also helps us then to plan new activities because we have a much better understanding of how long things actually take and who needs to be involved. And then the catalog component allows the data itself that we have available to become discoverable. So this is currently a work in progress, and it's a combination of elements you can see on the website as a human so that you can navigate, browse, and search, but it's also an electronic representation of what data assets are available so that search engines can pick this up, AI systems can pick this up, and as you query and interact with those agents, they're also able to say, yes, WHO has this data. So that's the basic structure of what is inside the World Health Data Hub. And we have services that are wrapped around this to allow users to either work on this on their own with a bit of support and training for us. And then we have a production capacity as well that we can bring to play in order to do more work with the technical programs and help them produce various dashboards and indicator pages and so on. Next slide. So the way that we're distributing our service is in terms of how we interact with the WHO community, is we break it down into the onboarding of teams, and so team/project. So each individual construct, if you will, like this, is onboarded individually. And so a team is a group of people working on a shared activity. So they don't have to be within the same organizational unit. They can be quite widespread. It can include consultants. It can include a collaborating center. So it's really quite flexible in who you bring in. For the most part right now, we're doing active work within HQ. However, we do work with regions as well in multiple different ways. With some regional offices, we onboard their teams just like any other team inside HQ. So from that perspective, the WHDH is actually quite flat. And it's because it really works as the data hub for WHO and not just for HQ. But in some cases, so we're exploring this with PAHO. We also want to be able to grant much broader controls at a regional level so that you can basically use, as a region, you can use everything that we have within the hub. So it's shared infrastructure and shared services, but the region controls the space that it's operating in. So it's able to apply its own policies, apply its own methods, and do anything else that would be regional specific that wouldn't necessarily work within another region or work with HQ. So we're working on that capacity. Next slide, please. And then the way that you can leverage this, so this is a sample use case. This is actually our most common thing that we do is technical programs will come to us with usually already acquired data. And the work is, how do we model this for dissemination and sharing? How do we manage the actual data itself? How can we store it securely? And how do we disseminate it? So it's the cycle here. I'm not going to read the entire slide, but the cycle here describes that basic flow. And that probably covers like 75% of the engagements that we do. So including the ones where we develop dashboards. So in the case of dashboards, there's an additional step, which is not super clear on this slide, but we're through the data dissemination portal, data.who.int. We work with you to develop an artifact like the MERS portal, the MERS dashboard. So that's, in a nutshell, that's the infrastructure, where it came from, and some of the servicing and tooling that's available to consolidate all this together so that we have a much more common approach for modeling data, disseminating data, distributing data in a consistent way, and doing this in a cost-efficient way as well. And with that, I will now hand it over to my colleague Apoorv, who will go on and talk about the kinds of feedback and enhancements we are hoping to get. So thank you, everyone. Over to you, Apoorv.
Thank you, Philippe. Yeah, so as Philippe mentioned, that it all started when we engaged Deloitte, and they shared us the pain points and the issues which we were having with the data management and data decimation, and then we from that feedback actually we ended up making it as a central piece in our roadmap to create a data decimation tool, so that we make sure that we keep their needs in hand and also keep on involving on the basis of the user feedback. Next slide, please. Next one. Yep. So we started the entire process of development of data decimation tool, which is Datadot, by by understanding the audience and different personas who interact with WHO data, to serve users well and to deeply understand their requirements. We developed various personas by interviewing 28 individuals across WHO and within WHO across different roles and geography, so that we can design tool which actually meets their need and most of the WHO stakeholders and data consumer needs. Next one, please. Then here you can see the geographic, I would say, diversity of various people with whom we engaged. Next slide, please. And then what we did is we not only created these personas, but we also ended up making sure that we have covered various roles, various interaction points, how people use and consume that data, so that we cover every aspect of data consumer of WHO, which is, or I would say, consumer of the data produced by WHO. Next slide, please. Then here we actually created a audience segment framework and also mapped various personas on this framework. After doing this mapping, next slide, please, we started having various interviews with them, in-depth interviews with them. We had a set of questions in order to understand the basic pain points, and these were the basic pain points. Like here you can see, we understood what are the various pain points of these users, and eventually, next slide, please, we created this foundation on the basis of which Datadot and the current platform on which you are viewing MERS dashboard was created. So the base the basis is that we want every data consumer to able to access the data which is produced by WHO. They can trust the data which has been produced by WHO, and they can eventually use that data to have actionable insights wherever they are consuming and in whatever context they are consuming the data. Next slide, please. Uh, one of the major pillar of Datadot is access equity. So we want to make sure that entire data consumers of WHO, able to access the data, use the data in an actionable way. The hardcore belief is that the health data is for public good, and it should be accessible to the remotest of the area, to make the data usable for creating maximum impact. Next, please. Yeah, and eventually, this is the product which we produced, right? So we reimagined the data communication, and it was not about just displaying the numbers, but actually telling the data stories in a way so that everyone can understand it and can engage it and engage with. Next one, please. Oh, sorry, can you go back to the previous one? Yeah. So if guys, if you want to that's the URL data.who.int. If you want to uh you know in depth understand what I am trying to explain in these slides, you can go to that website directly, and you will be able to have various examples of the products which we have created. One of the awesome products which we created on Datadot is COVID-19 dashboard also. So you can access various dashboards which we have created, and we keep on building our catalog there so that you will be able to get most of the information from from the platform. Now, next slide, please. Yeah. Yeah. So now this is so here you can see that consuming the data has changed a lot. Like earlier, we used to have PDFs, we used to print those out, we used to read that on our tablets or e-readers, but now we want them on our Instagram feed. Now we want them on X, we want to share them as a tweet, we want to share them on our WhatsApp. Even view that on our Apple Watches. So, and we have seen that around 80% of the consumers of our dashboard is on mobile device. So that's why the entire communication plan or the display plan for Datadog was curated to be consumed on various devices. Next slide, please. Yeah. So we were not building. So as I have mentioned that the core principle was that we want it to be accessible. So we didn't only created it in a single language, we made sure that the dashboard can be consumed in multiple languages also, at low bandwidth also, and it can be seen on any type of resolution of the devices. Next one, please. Yep. And so, yep. Apart from that, we also made sure that the data, there is a consistency in the representation of the data, because consistency actually builds trust. So we made sure that our data representations are modular, adaptable, scalable, but user gets a predictable high quality experience every time. So there is no like they are not seeing different type of notations or nomenclatures in various pages of the dashboard, or two different dashboards built out of a single platform. We made sure that there is a consistency, and hence the trust. The next one. Yeah, so we make sure that every visual element is designed with user empathy. So whenever you have a low connectivity, or the person who is actually viewing the dashboard is having color blindness or any kind of or they are visually impaired, the tool will be adapting it. It also even adapt to the theme of your device on which you are viewing your dashboard. So if you are on a dark themed device, the colors change. If you are visually impaired, the colors are chosen in a way that even with that unfortunate condition, you will be able to understand the charts. Next one, please. And now I will be talking about what we have planned, not only for Datadot, but also for like for MERS dashboard. So next one, please. Yeah. So before I move ahead with
Apov, I think you're phasing in and out. Is it just my problem, or Supriya, is this
I can hear him okay. I think I can hear him okay.
Okay. Okay, so I'll continue then. So our the data.roadmap or slash WHDH roadmap is continuously shaped by user inputs. And what we have recently heard from our users is that they want categorical data visualizations. They want comparative views across indicators and within indicators with geographic comparisons and more dynamic chart types. So these are the immediate next set of charts which we are working on. And after another cycle, or I would say sprint of development for the dashboards, you might end up seeing them on the live dashboards. We are actively listening to your feedback, and we will keep on evolving ourselves as per your feedback. Next one. And yeah, we in the next sprints of dashboards under guidance of Maria, Sophie, Abdullah, Philippe, we will keep on expanding the MERS dashboard also. So that's on this one. And next, please. Yep. Most important thing. So we totally believe that our stakeholders, our consumers, actually shape our roadmap. So we have opened up multiple ways for users to send feedback. Here on the slide, you will be seeing an email. Please feel free to email your feedbacks to us if you want to have any new if you want to add any features to it, you have any data availability requests or anything. Please feel free to email it to us, and we will make sure that we implement that after internal discussions and moderation. And that's all for me. Thank you. Thanks a lot.
Thank you very much, Philippe and Apurva. And just judging from the number of hearts and claps and thumbs up emojis, clearly the audience appreciates what you had to say. And talking of feedback, it's now time for the Q&A section, which will be moderated by Abdullah. So over to you, Abdullah. And I believe there are some 30 plus questions out there. So over to you.
Thank you, Sophia, so much, and we are very happy to have you enjoyed and have some questions for us. So I will go directly with a few questions that in the chat. Some of them we already answered them, and some of them we will answer them live. So we have questions. This I would believe regarding data, and the question is how to generate the dashboard. And then we have a question as well. The data available to download does not contain demographic exposures and clinical variables, and this is the same. I will just address some questions regarding the data. So and then how can how can countries submit data to populated into the resources? So as I understand, it should be submitted through the HR, and then it will be used for this dashboard. I do believe I will hand it over first to Sophie and then to Abroad maybe regarding the data.
Yeah, thank you, Abdullah. And maybe to this last point first. So indeed, as I mentioned initially, we are only displaying officially confirmed and reported human case data on this dashboard. This is the data that countries submit through the IHR to WHO. So indeed, in order to be displayed on this dashboard, it needs to be an officially confirmed human case reported through the right mechanisms. I want to mention again, though, our MERS tracker dashboard that you can find under other resources, as Abdullah had shown you, quite on top, I think on the top left, which is actually a second dashboard that gives you access to any field studies conducted and results from these field studies. So these are seroprevalence studies, and we also feature virological test results, both for humans and for animals. So I just want to make you available again about this other resource that we have that provides you with additional data. and which actually, we didn't go into detail on this, but if you only look at the officially reported human case data, you miss out parts of the world that are still at risk of MERS-CoV infection because the virus has been confirmed to circulate in camels, in its zoonotic host, in its animal host. And so with the other dashboard, the MERS tracker, you can actually access this kind of information because it shows you where we have the virus circulating in animal populations. I also want to quickly reply to the data download. So indeed, the data download that we provide right now is quite limited. So first of all, of course, WHO cannot give access to the full database that we have with all the details because we cannot provide access to data where cases could be identified. So we have to limit it to, or limit the public access to only a few data points. However, I saw that Philippe might or Apov might want to answer how the data generated by the dashboard can actually be used additionally to just copy pasting the graphs that we produce for you. So the idea is use as much as you can just by what we provide you. Any additional analysis would need to be restricted to this general data. Maybe I stop here and I can come back on other questions later, Abdul.
Thank you, Sophie, so much. Apurva, is there anything you would like to add, or shall I go to the next questions? Okay, I will go then to the next question. So we have questions asking that we have actually the same question repeated maybe 3 or 4 times from different participants. So what is Saudi Arabia is doing in the event of mass gathering regarding to prevent MERS-CoV spreading within the pilgrims? I don't know if I handed this over to you again, Sophie, or shall I? Can you just give a few comments about it? What do you think about it?
Maybe you can answer this as you suggested.
Okay, so basically, Saudi Arabia is doing a huge works to prevent MERS-CoV spread within the pilgrims or any mass gathering events. So they are stopping all the zoonotic spillovers who are high at risk, like the dromedary camels, specifically within the MERS. They're not allowing to get into the area where the pilgrims or the holy cities, we call them Mecca and Medinas. They're not allowed to get in, and all the animals are screening and taking all the prevention measures to make sure that they're healthy and there is no risk to spillovers. And also the abattoir is the abattoirs is a bit far away from the pilgrims. So and in Saudi Arabia, they do have 100 centenary surveillance, and they do take respiratory very high, they do invest a lot in that part. So in hospitals, they do take random samples from different patients in case they visit the healthcare facility, and they do test them for flu A, B, RSV, and as well MERS, to make sure that the MERS is not spreading well. And there was quite a literature review has been published recently that's speaking about the surveillance during Al-Hajj, and so far there is no risk, or at least as we have observed, there is not much risk at the moment. And but we do keep in contact all the times with Saudi Arabia, and so far everything is quite well. Yes, and I hope I could answer these questions. Yeah, and then we have questions regarding there was any questions how Saudi Arabia is handling the sentinel surveillance in Saudi Arabia. So as I said, Saudi Arabia has 100 sentinel surveillance. They do test for flu A, B, RSVs, and if they're negative, they do test them as well for the MERS-CoV. Okay, good that I answered it. Okay. And I'm checking. Do we have extra minutes, Sophie and Sophia, or we can share answer the question by chat?
You can share. I'm sure we can go over by a few minutes, not a problem.
Okay.
Maybe I can come in, Abdullah. There were a couple of other things I noted. So someone made the very good suggestion to include additional data like sequence information. And indeed, maybe this is also something to tell you. So this is the first prototype of this dashboard that we are very proud to launch today, but we are already working on ideas for updates that we will do in the future, and indeed including sequence information and maybe even phylogenetic trees. This is an idea for the future, and we hope to be able to include it. Also, there were questions on how often we will update the dashboard. So since right now, as you saw also from the EPI curve, the situation is relatively stable, and we have few cases reported every year. So we're currently thinking of updates probably every 3 months. However, of course, if there should be a significant change in the epidemiological situation, if there should be a cluster or an outbreak that is noteworthy, then we will do ad hoc updates with that data, because it's important to be aware. This is really a tool for early warning as well. And then there was a question on how to classify cases that are exposed in one country, then travel to another and actually detected in that other country. So as per our reporting mechanism, that second country would report the case, and we would register the case as a traveler case in that second country. So it would show on our map in that second country, not the country where it was necessarily exposed, but that other country reporting it. However, in the metadata, we will, of course, collect information on where the case was exposed and on all the history, the travel history, and so on. So this information will be known for us and will be recorded. And Abdullah, that makes me wonder, maybe we should in future also add a section on traveler cases to show how many of these cases were actually exposed in a different country than reported. And I will stop here.
Thank you so much, Sophie. We have questions for maybe Philippe. How can WHO protect the data from the cyber attack? Over to you, Philippe, please.
Oh, so the way that our systems are implemented is we go through a set of thorough security reviews against cyber attack. We also follow compliance with a set of cybersecurity policies that are dictated by our IT department. So before we even get a security assessment of our implementation, we have to demonstrate an engineering approach that complies with all of the security requirements. We do a separate risk assessment against applications and services to identify the level of risk in case of a breach, which in turns expands on the security requirements you have to meet. And then when everything's ready to go, we have a disturbingly efficient cybersecurity penetration team that basically tries to slice a hole in whatever we build, and they're quite good. So once you survive all of that, it's reasonably safe. Now, in the case of everything that we do on the World Health Data Hub, for the most part, the data that we work with, when it gets to a point where it's exposed for dissemination, is actually data that's been cleared for public consumption, and it's all read-only on the public-facing parts. So there's not really anything to breach there.
Thank you so much, Philippe. There's one question, maybe I will hand it over to Sophie. How much of data publicly available? We want to balance policy needs for the discretion and the public right to know. Over to you, Sophie.
Yes, and I was just going to answer this in the chat actually and provide you a link to the WHO disease outbreak news, where you can actually find details on the cases reported by countries, which are published on a regular basis. And this is, of course, part of the data that is hosted by WHO's global database. So the part that we make publicly available can be found in these DONs, and I put the link as a reply to your question.
Thank you so much, Sophie. We have a question maybe as well back to you, Philip. So with Health Data Hub, Are there any collaboration taking place between the WHO Data Hub and the WHO Hub for Pandemic and Epidemic Intelligence?
Yes, but they're all in the background. They're all on the back end side. So we've been doing some stuff for things like influenza, and we've also worked the pandemic
I'm afraid we
intelligence
lost you.
hub.
Could you repeat, please?
Sorry, can you hear me?
We lost you. We lost you. Now we hear you back clear.
Uh, how about now?
Yeah. Yes, please.
Yes, I can hear you, Philippe. I think Abdullah, it's on your end, the connection problem.
Okay. All right. So I'll just recap. So we do have some work with the Pandemic Intelligence Hub, but it's pretty much on the back-end systems right now. So we've done a little bit of work with influenza along with them, and we've consulted on different technical projects that they are wanting to do, but it's really at the conceptual and analysis level on the back end. But we do want to have more collaborations there, because the interesting thing with the Pandemic Intelligence Hub is they have all of this approach to analysis, and they have requirements for working with data and all of the stuff that we exist to serve, but they don't have as much infrastructure in order to do this. So we're a good match. Like, we can provide the computational layer for the Pandemic Intelligence Hub.
Thank you so much, Philippe. And I do believe we can. We will try to answer them in the chats and over.
Thank you, Abdullah, and thank you very much to everyone here. It's incredible the number of questions there are. So clearly a lot of interest. A huge congratulations to the entire team for this achievement. And thank you to all the speakers for explaining this new dashboard. And thank you also to the participants, because clearly it's going to be useful from what I can see from the chat, from the Q&As, and also from all the emojis. So taking public health, support for public health emergencies forward, great achievement. I'd also like to thank those people who've been working in the background in this webinar. Michael, who's been working, sending out the chat announcements to you, and also been working in the background to set this going. Project Echo, our partner in these webinars, and particularly today Sanghamitra, who's also been helping with the slides and the chat and everything else. So huge thank you to those in the background as well. And I'm wishing you all the success you can have with this dashboard, and looking forward to even improved versions in future as well. And for the audience, I'd like to announce that from Middle Eastern respiratory virus this week, next week we will going to go to Aedes virus, to the yellow fever outbreak in Latin America. So next week's webinar will be it's on the chat, and the link is also on the chat. And we look forward to hearing you there. It's called Growing Threat of Urban Yellow Fever in Latin America and Control Strategies. So we look forward to seeing you next week. And thank you once again to all the speakers, all the participants, and everyone involved. Thank you for supporting EPIWIN, and bye-bye.